Welcome everybody to the Austin LGBT Chamber of Commerce 1 year later mental health and physical health webinar. We are the Austin LGBT Chamber. We're established in 1997. We are Texas' home for LGBT businesses and allies. Today we're going to be talking about the effects of the pandemic over the last year and talking to some specialists who are going to walk us through some tips and tricks to help us for the next year. I'm happy to introduce Rich Siegel and Katie from Ally Medical Center as they walk us through our webinar. Katie, will you go ahead and take it from here?
Absolutely. Good afternoon, everybody. My name is Katie Rankin. I'm the marketing director for Ally Medical Emergency Room. We are very happy to have Dr. Jeremy Kinter to start us off today. He's going to be talking about the VAMP infusion and also be covering a few other topics for us. You might recognize him. He has done a couple of these webinars for us. He's also going to talk a little bit about the vaccines, and as we know with COVID, we are officially 1 year later. So without further ado, Dr. Jeremy Kinter.
Thanks for the introduction. It's been quite a year and an interesting start to 2021, right? So let me share my screen here. Okay, I think everybody should see this front page. So again, I'm Dr. Jeremy Kinter. I'm the Chief Medical Officer of Ally Medical Emergency Room. We've got multiple locations, Houston and Austin area. We've got one in Central off Burnett Road, in South Austin off of Manchac, and then Round Rock and Bastrop. And what I wanted to talk to you guys today basically is about what's been going on for the last year. So this little graph is from the Austin Public Health website. This is essentially showing hospitalizations throughout mostly the last year. This is the data, you know, a lot of people pay attention to case counts, but from a healthcare professional, our hospitals and who gets admitted is one easy way to track basically the widespread issues that we're having with COVID. So as you can see, basically when we were in lockdown mode back here in May, we were at stage 2, kind of hovering between stage 2 and stage 3. And then we hit that big spike in June, came back down for a couple of months. And then I think everybody knows this winter spike with Thanksgiving and the holidays and everything. We ramped up quite a bit in the late December, early January. And it looks like we've come down quite nicely. We're still actually in stage 4 from the Austin Public Health standpoint, but our numbers are hovering right around the top of stage 3. So you know, that's fantastic. I am really hoping that with vaccinations and with everyone being safe, that we won't have as drastic as a spike. We might have another little mini spike with spring break and you know, just the mask stuff that's going on, but I'm hoping that it won't be as drastic as we had back here in December. So we're moving in the right direction, which is fantastic. So what I wanted to talk to you guys about today is essentially 2 things. One is our antibody infusions. A lot of people around, or a lot of healthcare facilities around the Austin area are doing these. We definitely do them at Ally Medical Emergency Room. The other one is the COVID-19 vaccine. So they are a little bit tricky to distinguish the two. Essentially, an antibody infusion is what's going to be treating you if you're already infected. And then the vaccine obviously is trying to prevent you from having an infection. So here's a little breakdown of the two. What the antibody essentially does is when the SARS-CoV-2 virus, which causes COVID-19, gets into your body, it needs to make it into your cells. And what the antibody does is it essentially attaches to the virus so that it can't enter your cell. It basically neutralizes it so that your body can kill it without getting into your cell. And our goal with this infusion is to start it on somebody within the first 10 days that they are found out to have COVID. The sooner the better. Our body naturally doesn't develop antibodies it starts developing some very early on, but really it takes a couple of weeks before our immune system really gets ramped up with fighting off COVID. So when we give this infusion, which takes about an hour, it does start working immediately, and the medication, the antibodies actually don't start breaking down till about 20 to 30 days later. So this antibody therapy, these antibodies circulating in your system are there for about a month. So it gives you good protection, and it's been shown clinically to lead to people having better outcomes. We only give it to those that are high risk. So those that are over 65, or if you're over 55 with some health conditions, or even if you're over 12 years old and you've got more chronic conditions like asthma or immune suppression, or if you're taking immune therapy, things like that. So it is authorized by the FDA as long as you meet those qualifications. And when we give it in the ER, it's just a simple IV that you stick in your arm, and we infuse it over an hour. Very minimal side effects. And then, of course, we've got the vaccine on the right, which everyone should know about. Essentially, you're trying to build up your immune system to fight off COVID before you ever get it. And we can talk more in just a little bit about how our area is doing and the different vaccines we have available. So this is one of the antibodies we give. It's called bamlanivimab. It's very hard to pronounce. Most people have problems, but as long as you say antibody infusion, most healthcare professionals should know what you're talking about. And what it does is there's a little bag hanging on that IV pole, and the medication's in that bag, and it slowly drips into an IV that we place. It's not painful at all. The side effects are extremely limited. Some people develop a little bit of nausea, but that's only a few percent. Most people over that hour just hang out while the infusion goes, just like if you were getting some antibiotics if you were in the hospital. Very quick, very easy, and people have definitely felt great afterwards. So we're happy to be able to provide this to the community. We actually are going to be adding one other antibody soon, and the combination of the antibodies has been shown to actually have even better results. So we're happy to have this. We're happy that just our local Austin area has this. I know St. David's, Seton, and a lot of other outpatient centers are starting to have access to do these infusions. So we're pretty excited that the community has access to this. So moving on to the vaccines, we've really got 3 vaccines now. I think most people are probably aware about the Pfizer and Moderna vaccines, which are the messenger RNA vaccines. These are the ones that basically trick your own immune system to make a protein that looks like the coronavirus, so that your body kind of forms an immunity against it. They're extremely effective. As you see here, there's 95% effective at either basically preventing symptomatic or people from getting COVID-19 and having symptoms, which is ultimately what we want. You know, you want to keep people out of the hospital. You want to keep people from getting sick with this. If all it does is end up causing a little bit of sniffles and no long-term health complications, that's a huge win for the medical community. The one issue with both of these is that they do require, well, specifically the Pfizer requires deep freeze. Moderna doesn't require as much, but it still requires really cold temperatures to keep it. And then also that there are 2 shots, which can cause quite a bit of issues. It's very easy to just give one person 1 shot and you don't have to see them again. But when you have to schedule their second shot and make sure that, you know, Pfizer's 3 weeks apart, Moderna's 4 weeks apart, it becomes a little bit trickier to start vaccinating your population. The newest one that came out is the Johnson and Johnson vaccine. This one is much more similar to the flu vaccine, where they essentially use a virus that not many people are exposed to, and it's not live. It's just like the outer casing, so it can't infect you or anything. But they use that instead of the RNA passage to get it into your body. The effectiveness is not as good. but there's a couple caveats to that. One being that they started studying this when the new variant started to come out. So it's hard to say whether or not that has any indication of affecting how good this is at preventing symptomatic people to develop COVID-19. But also know that 66% is actually really good. This is about what our influenza vaccine effectiveness is. I think it's actually a little bit higher. So even though the Pfizer and Moderna's are fantastic, if I was given the opportunity to get any of these three, I would get just anyone that I can get it first and foremost, because 66% is actually a really good effectiveness for a vaccine. And the great thing about this one is that it only is at refrigeration temperatures. It lasts a long time, 3 months. You don't have to store it at sub-zero temperatures, and it's only one shot, so you don't have to schedule a return visit, which is fantastic, especially for other parts of the world where it might be much more difficult to schedule these things. So if we look at, this is essentially how many people have been given a dose of the vaccine. The doses given in Texas is almost 7 million, 2.5 being fully vaccinated, which means it's either going to be the 1 Johnson & Johnson shot or the 2 Pfizer and Moderna shots, which is about 8% of our population. Unfortunately, that is a little bit lower than the rest of the United States, which is more closer to the 10% range. Austin area itself is actually lower than that, but versus the rest of the world, we're definitely a lot faster to vaccinate, just because the U.S. has stockpiled so many of these doses to be able to give to our population. So really, it's just the issue trying to get them into people's arms rather than obtaining them. And then these are our numbers for the Austin area. It's a little bit busy, but all you really need to do is pay attention to is the blue letters. So basically 66,000 doses have been administered. And then our population is 1.275 million. So that's around 5% of the Austin area population has been administered at least one dose. Ultimately, around 17,000 people over the age of 65, which is really the population that we want to target, because they're most likely the ones to be hospitalized. If we can at least keep people out of the hospital, keep our ICU bed capacity open, you have a lot less chance of dying of COVID-19 if you do catch it. So we've got some work to do. I think the numbers are just going to continue to climb, which is great. But definitely still have some work to do. And then latest, the CDC just put out new guidelines for people that are fully vaccinated. Some of these are kind of intuitive, but essentially everything stays the same for anyone fully vaccinated, except for a couple of changes. One is if you are exposed to COVID-19, even if you have no symptoms, or essentially if you have no symptoms, you do not need to quarantine and you don't need to get a test. If you do start to develop symptoms of cough or shortness of breath or fatigue or any of the classic signs of COVID-19, you do need to then isolate yourself and test. But as long as you have no symptoms, you actually don't need to do either, which is fantastic. And then the one we all care about, the one that we all want to be close to our loved ones, that you don't actually have to wear a mask or physically distance yourself if you're around people that are also fully vaccinated. And one little caveat they have is that if you're basically with people that you know well, they include one other household, which is kind of a weird distinguishing factor. But essentially, if the other people that you're with, as long as it's not an extremely large group, if none of them are high risk for COVID-19, meaning they're not over 65 or they're not over 55 with health conditions, or they don't have any sort of immunosuppressive state, then they're okay with you being around them. So those are all great things. It's kind of a slow baby step in the right direction. I'm sure the CDC will release newer guidelines the more information we have, but it's just so new right now that they're not really sure exactly how lax they can be with any of these physically distanced or mask guidelines, because we just haven't had people that are vaccinated for that long. So hopefully over the coming months, they'll be able to broaden these guidelines and help us get back to a normal life. And that's all I had. So thanks for taking the time to listen to my presentation. I'm glad that it seems like we're seeing the light at the end of the tunnel. Our cases are way down. Hopefully it continues in that direction, and hopefully we get more vaccinations or more vaccines in people's arms.
Awesome. Thank you, Dr. Kinter. We did have a few minutes for Q&A. So if anybody has any questions, if they want to drop it in the chat and I can read it. If not, then we're going to move on to our next speaker. So I'll give you guys just a few minutes, a minute here to see if we have anything pop up in the chat, and then we'll move on. I know that was a lot of very good information.
Thank you very much, Dr. Kenter. We appreciate your expertise this morning or this afternoon.
Absolutely, no problem.
All right, I'm not seeing any questions pop up, so I think we're going to go ahead and move on. So Michael, if you're there, if you want to go ahead and introduce our next speaker.
Certainly. Good afternoon. Thank you, Katie, and thank you, everyone. Good afternoon. My name is Michael. I'm with the Director of Business Development here for Austin Oaks Hospital, and we are super excited to be able to offer a presentation for you guys for a COVID-19 1 year later. I did want to give an introduction to our presenter this afternoon, Susan Bednar-Haynes. She has been practicing expressive therapy for over 25 years. She has corporate, educational, and private practice experience using music, art, and breath work to increase healing and decrease anxiety and stress. Susan's specialty has been treating all forms of anxiety in children, adolescents, and adults through evidence-based practice using movement and music. She is the author of relaxation CDs and trainer manuals and booklets. Currently, Susan is the Director of Expressive Therapy for Austin Oaks Hospital and has a private practice. So I will pass the floor over to Susan Bednar-Haynes, who will provide you guys with some information on mental health and COVID 1 year later.
Thank you, Michael, and thank you all for having me. This presentation is going to, you might need a pencil and paper the good old-fashioned way if it's not very clear. So I don't have a PowerPoint. I'll be using something that's a little more interactive, which is the whiteboard. When Michael first approached me and asked me about presenting, looking at how there has been a delayed response from almost the traumatic event of dealing with COVID, and we're actually seeing many, many more cases of generalized anxiety as well as depression. So I know we don't have a whole lot of time, so I just wanted to capture the pieces that I'm seeing with patients here in the hospital, as well as private clients from children, adolescents, and adults of what we're seeing a year later. In particular, our adolescent and our children's program has really increased in numbers. A big part of that is being homeschooled and the forced exposure between the children and their families that they haven't had this much time together, and we're learning as we go. So there hasn't been, it's almost crisis intervention instead of prevention because this was so new to us. So in the short period of time, I wanted to address the difference between situational depression and chronic depression. Those two, I think, are very, very important in terms of children, adolescents, and adults. And as I'm presenting, if you have any questions in particular for yourself personally, professionally, or friends or anybody to use this time to ask me. I'm here as your resource. So situational depression involves symptoms of depression related to stress. It's triggered by a traumatic event, COVID, or even I'm going to also address the ice storm that we've had. Many of us do very, very well in a crisis, and it's afterwards that feelings of depression, feelings of loss, feelings of anxiety come up later. The sudden stress or a life change might be a serious accident, a divorce or a breakup, a job loss, a death of a loved one, financial problems, retirement, illness. And this is situational. Situational is there's an event, a specific event, a death of a loved one, lost my job, I'm retired. And then 3 to 6 months later, what happens is the feelings, the mental health piece comes up in terms of loss. And I'm going to talk about what some of those symptoms are. It sets within a 90-day, 60 to 90-day period of the event and receding by 6 months after triggering the event. That's the big thing to remember between situational and chronic depression. Situational depression will dissipate 6 months or less, but chronic depression continues longer than that. Someone had said something earlier on the board here, and I think that's really, really important, that many of us still have shame related to mental illness. So I'm hoping one of the biggest things is to be able to talk about it and stay connected. There's such strength in vulnerability. The more vulnerable we are, it takes strength to be vulnerable to say, I'm feeling depressed. I can't get up out of bed. I'm not sure what's going on. One of the biggest things we want to do is to stay connected with loved ones and our friends. Because often what happens is when we're depressed, we want to isolate. We want to stay in bed and stay in that darkness. And that's the comfort zone. But push yourself to stay connected. I'm going to talk a little bit more about what else we can do as well. And then Michael is going to leave our contact information and my contact information. If anybody has specific questions that watches this later, please use us as a resource, and everything will be confidential. Clinical depression, and there's subcategories of clinical depression that for the sake of the time today, I'm not going to go into the subcategories of that, but for right now, clinical depression versus situational depression. Clinical or chronic depression, long-term symptoms that have a major impact on one's quality of life. I don't feel like bathing. I don't feel like interacting with people. I don't feel like eating. I can't sleep. And this lasts 6 months or more. This is something that's long-term. In situational depression, many of us will experience one or many of these just naturally in our life path in terms of the situational depression. We're all going to experience some sort of loss on a regular basis. And many of us can function going to work, going to interact with people and still wear this mask. And underneath that mask is the depression. But in chronic depression, it's harder for them to continue their ADLs or their activities of daily living, which is interacting with family, friends, going to work, and so forth. The biggest theme with both of this is loss, some level of loss. Loss is, even when we talked about, or I talked about actually the ice storm, the enormous loss of water. What do I do? Power, what do I do? And I think the biggest thing with the people that I've spoken with, the clients and the patients, is not knowing how long this is going to last. Kind of the fear of the unknown that caused enormous anxiety. What do I do? How much water do I keep in the bathtubs? What if, the what if? And if we are already prone to depression and depression and anxiety are very, very much related. If we're already prone to that, individually, it's within our family, genetically, then whenever there's a crisis, these feelings of loneliness, sadness are only going to exacerbate under crises like with what we experienced with COVID as well as the ice storm. Overwhelming sadness and crying I'm crying, but I don't even know what's happening when I'm crying. Often too, what happens is we stay, especially somebody that might be experiencing chronic depression, staying so busy, and kind of just working on autopilot. And then when there's stillness or not activity, feelings come to the surface, and feelings of sadness often occur when we allow ourselves to meditate, to do yoga, to do breath work, whatever that might be. Appetite and sleep goes one way or the other. And these are early warning signs for situational depression and then later chronic depression. Sleep and appetite go one way or the other in terms of increased appetite, overeating to self-soothe, or not eating at all. Same with sleep, oversleeping, just want to sleep all the time or not being able to sleep at all. So those two pieces are either one way or the other. Fatigue, tired, achiness, physical pain even that is real for that person. Often my patients will say, I feel like that there's a dark cloud over me and I can't seem to get away from that dark cloud, and will experience physically this heaviness of this dark cloud with the depression. And then of course, chronically, not of course, but often in the chronic state of depression, it's thoughts of death. Now coping, one of the biggest things is exercise, to push ourselves and to move through this. It's interesting now, I don't know how many weeks, has it been 3 or 4 weeks since the ice storm? About 3 weeks, yeah. So we're seeing, again, people that are coming into the hospital for help that did well during the ice storm. And then now they're experiencing the feelings emotionally catching up with themselves physically. Exercise is huge. Even if you intellectually we know this, but to push yourself to get up out of bed, walk around the block, that's a start. Being outside in nature is so much better than the darkness of the rooms, of your bedroom. I mentioned this also, that when people are isolated and living by themselves, these feelings are even greater because there isn't a partner, there isn't a child, there isn't a family member to connect with. And sometimes they have pets, sometimes they don't, but just to be aware of our neighbors and reach out to them. Reach out to friends and loved ones and connect, whether that if you don't feel good physically reaching out, reach out via the cell phone, computer, and connecting to step outside of yourself, because it's so easy to just ruminate and go down that black hole. Maintain your routines and structure. You're not going to feel like it, so you push yourself physically, and then emotionally, it'll catch up with you that you're going to feel better, even if it's just for a few minutes. Stay connected, and of course, then is seek treatment. If these coping techniques are not helping you, seek treatment, especially when it's chronic depression and chronic anxiety. Psychotherapy and medication, the two of them paired together, is often the best. And then, of course, as I said before that, to go ahead and push yourself. A year later, the resiliency that we have had as human beings has been phenomenal. And I think it's so important also that internal self-talk, to realize what you have done to get through this and to get through this time. And sometimes when we say, oh, I'm strong, I don't need I'm going to be okay, I'm going to be okay. It's often those folks, myself included, that then later feelings come to the surface. And it's okay not to be strong. It's okay that you got through this, you're resilient, but allow yourself to experience these feelings. When you bottle them up, other issues come up, often physical issues. Our bodies are the first sign of stress before our minds. So some of the early warning signs or heart palpitations, chronic back or shoulder pain, shortness of breath, losing weight, gaining weight. And often what we say is, oh, that's nothing, I must have slept wrong. But when it continues for a week or more, that's something really important to look at. My body is telling me something that emotionally I need to connect with. So I know I talked about quite a few things on here. And there has been just incredible, wonderful stories of the resiliency of the human spirit that we have all seen, and to remember that as well, I think is really powerful. Does anyone have any questions at all about what I had spoken about? It's a lot to take in, and if you don't have it now, Michael's going to put up my contact information and the hospital's contact information. That often what comes up is a day later, oh, I wish I would have asked this question. And so feel free, process this information, let the ideas and thoughts incubate, and then you may have some questions at a later date. But any questions now, anyone?
I have one.
Yes.
And if you covered this, I'm sorry. You gave us a lot of wonderful information for which I'm eternally grateful.
Thank you.
If someone is just being, gosh, how do I want to phrase this correctly? If they don't feel comfortable seeking a a professional when they are having issues like you have described, and they want to reach out to friends, what's the best thing that I can do to help someone maybe get a clearer focus on things? Does that make sense?
It does. I'm going to ask you some questions though, to clarify it even a little bit more for me so that I can.
Sure.
And we all have friends or family that we can see with a better lens than the person that's suffering. And so it's hard because we're going to love our loved one. We know what might help them, but honestly, it has to be their journey and their decision. And in therapy, we meet the person where they are. In our lives, the same thing. It's easier to say that because it's also hard not to get emotionally connected and to feel so frustrated emotionally. But I think if you meet them where they are, you come in through the back door in a kind way and letting them know, I care for you, I love you, I see that you are suffering, and I'm glad you're reaching out to me, and continue to do that. But I would also like, in addition to me, also have some other resources.
Okay.
Also, it's also a fine line too, and please ask me more questions if I'm not answering this.
No, you are.
Also, because we can become very, very frustrated by constantly giving and giving and giving, and then they might continue to use us, and then we're not taking care of ourselves and realize we're getting frustrated. And because we get frustrated, we then leave our loved one just to regroup. That's really natural, but just to be aware of your own feelings as well, and how much can you give. And the example that I give is, here's an empty pitcher of water. I have to give to myself. I have to make sure I'm sleeping, I'm coping with my own feelings of depression and anxiety in order to give back to our loved ones. So it is a balance. It's frustrating, but it's also that person's journey and their right not to seek help. So
You can only do so much.
correct. Yes, exactly. And let them know, if you're still at a place to continue to give to them, listen to them, let them know, I'm glad you're coming to me. I know this might be hard, validate where they are. In addition, I know this counselor such and such, or this doctor such and such, that might help you. That might help you out of this pain. If you choose to be there, I'm going to support you as best I can.
Thank you.
This is also the other thing we hear about this often in recovery. People have to feel even worse before they seek help. So if they're still functioning in this situational depression, there's still a piece of denial. It might go into chronic depression. And sometimes they don't realize it until they reach rock bottom. And it's
Okay.
his loved ones to see that, but out of that piece is when they often seek help.
Thank you.
You're welcome. My pleasure. Anybody else?
It looks like we do have a really great question here in the chat. It says, do you have suggestions for people who have chronic depression and now have the situational depression as well?
Great question. Great question. So they're combined now. So if you already have a history of chronic clinical depression, the situational depression adds to it. In my presentation, they were two distinct types of depression. Situational is due to the ice storm, is due to a loss of some sort, financially, personally. Short term, lasts 6 months or less, then gone. Chronic depression, if you have the chronic depression, the situational depression is going to exacerbate all of the symptoms that I had mentioned before. So if it's something that you've already been seeking treatment, therapy, and or medication, again, I would be transparent and to your mental health providers and your physician, your PCP. Let them know as well. If you are experiencing shame with the mental illness piece or the depression or anxiety, go to your PCP and your primary care physician and let them know, because there's no need. Our lives are so short, and to suffer, we don't have to, and there are solutions. Biggest one holistically would be exercise and movement, and my guess, I don't know, and I appreciate that question. If you've been suffering from chronic clinical depression, that the medication might need to be adjusted, especially during this time with the situations we have had, and also to validate it's normal. It is normal that if you've been one to have to suffer through depression during this time, you're feeling even more depressed. It's normal. Voice it, stay connected, and continue to seek professional help is my suggestion. Thank you for that question. Anybody else? Okay. Thank you all for allowing me to present. Michael, did
Put the
you?
contact info in the chat.
Okay, great. Michael will put the contact information in later. And thank you all.
Thank you so much for joining us.
Absolutely.
Thank you, doctors, both of you. You did an amazing job presenting. We're going to open it up for any questions. If anyone has any, we'll kind of watch the chat here. I'm going to hand it over to Rich Siegel so he can start to wrap us up and let you know a little bit about our committee and how you might be able to join.
Thank you, Stephanie. First of all, thank you, Dr. Kenter. Thank you, Dr. Bednar-Haynes, for the valuable information that you allowed us to learn today. It's always to expand our knowledge base when it comes to what we're going through with COVID, and as we progress further with the vaccines and hopefully seeing an end to this before too long. The Health and Wellness Committee's next event is going to be the second Wednesday of May. I'm not sure what the exact day is, and we'll be talking about senior care. Lena Zupata will be will be handling that event for us. We meet at 10 a.m. before the scheduled webinar. Hopefully one of these days we'll be able to say we're having a seminar at such and such place, and that we can get away from the Zoom meetings, because I know that a lot of people are Zoomed out. If you would like to be a member of the Health and Wellness Committee, if you're watching this after the live event, please feel free to drop me a line. My email address is rsiegel@austinlgbt.com, lgbtchamber.com, and we will get you hooked up, and we'll look forward to having you be a part of what we do. Katie, do you have anything before we close?
No, I don't think so. Just thank you everyone for everyone that was able to participate in the call today.
And again, Katie and Michael, thank you for arranging for your experts to be a part of this panel, this discussion today.
Thank you, everybody, for joining us. I will have this video live in the next 24 hours on our website, and we'll make sure that it is available online for anybody that needs it.
Have a good day, everybody.
Have a good day, everybody.
Thanks, you too.
Thanks.